So by just hearing this name, thyroid storm, you just simply know that okay, this is a problem. And this is usually when what the thyroid hormone levels in the body have gotten too high. All right. Management of thyroid storm. All right. So here now we are trying to look at how you can be able to now rehabilitate the patient. You try, and bring them back to the normal situation. All right. Management of thyroid storm. All right. So for the thyroid storm management, yeah, first of all, you admit the patient to the ICU. ICU is what? Intensive care unit. Some hospitals name it as what? ITU. That's what? Intensive treatment unit. Now, the thyroid storm is an emergency. Do you understand? So you don't keep the patient in the normal hospital ward. You keep the patient where they are having, how will I put it? A one-to-one care and attention. Do you understand? Then, what is causing the thyroid storm? The thing causing the thyroid storm is as a result of what? Too much thyroid hormone in the body. So now you are trying to now reduce the thyroid hormone, all right? So you can be giving them medications that will reduce the level at which thyroid hormone is being formed in the body. That's the therapy that is reducing what? Thyroid hormone synthesis. All right, like propylthiouracil, you give it about what? 600 milligrams loading dose. All right, that's a starting dose. Then later on, you give it about 200 to 300 milligrams 6 hourly via the nasogastric tube or via the rectum. Okay, then potassium iodide, you give it about 5 drops 6 hourly. All right, you can give it together with what? Sodium iodide. Okay, then propranolol, about 40 to 60 milligrams hourly per us, or 2 milligrams if you are giving what? Intravenously 4 hours. Okay, then the dexamethasone, about 2 milligrams 6 hourly. Then if you are having other associated comorbidities like what? Heart failure or arrhythmias, that one you'll be giving medications for heart failure and arrhythmias. Do you understand? Then if you are having infections and all that, you giving antibiotics for possible infections, right? Then identify and treat precipitating factors. All right, there could be some things that are triggering this disease condition to come into play. All right, identify and treat. Okay, then cooling blankets. Thyroid storm, too much thyroid hormone levels in the body, and the temperatures are going high and high. So try to cool the patient. Right, then alternative intramuscular chlorpromazine can also be given. All right, so we're ending this by just recapping on the symptoms of a thyroid storm. The patient will be having a crazy fever, be having agitation, they'll be restless. All right. Like, let me say some people in my class, they are everywhere. The staff had to ask them if they had a problem with their thyroid gland, and we're all laughing in the class, right? So don't be everywhere, okay? But for this type of patients, they're agitated, they are everywhere, right? Delirium, overthinking, depression, the congestive heart failure, then loss of consciousness ultimately. All right. So these are the possible managements or treatments of thyroid storm.